Hello and welcome to Thrive eLearning. We're thrilled that you've decided to join us for the Thrive ePulmonary program. The ePulmonary program is an all-encompassing masterclass that will empower you with all the skills that you need to take control of your respiratory disease.
Corticosteroids are an essential part of the treatment of COPD and other inflammation-related diseases. Corticosteroids are synthetic versions of steroid hormones that occur naturally within our bodies, such as cortisol. I messed up real bad. Fuck.
Oh man.
What a day.
Last one.
Corticosteroids are an essential part of the treatment of COPD and other inflammation-related diseases. Corticosteroids are synthetic versions of steroid hormones that occur naturally within our bodies, such as cortisol. They effectively aid in reducing swelling in airways and muscle groups. As beneficial as this family of drugs is, there are some unfortunate side effects. One of the unfortunate drawbacks to long-term corticosteroid use is that they are detrimental to bone health. It has been proven that regular corticosteroid use for longer than 3 months impedes the way your body absorbs and metabolizes vitamin D and calcium. There has been a lot of conflicting evidence in the recent years as to whether calcium and vitamin D levels affect exacerbation risk. However, it is known that these minerals are absolutely essential for bone health. Calcium is absolutely essential for our bodies to function. Calcium allows for blood to clot when we cut ourselves. It helps our muscles contract and function properly, and is even essential for the beating of our heart. Even participating in all those functions, 99% of the body's calcium resides in our teeth and bones, where it is an essential building block. The body naturally loses calcium every day through secreting sweat, urine, and bodily waste. It is also used for growing hair, nails, and new skin cells. If the body doesn't have a large enough store of calcium to perform these functions, it uses some of the calcium stored in our bones. This is a natural and normal occurrence, but if it happens too often, it will cause bones to weaken and fracture more easily. The body doesn't produce its own calcium, so we must make sure that we are eating a calcium-rich diet, or if your doctor recommends it, regularly taking some supplements. If you're developing a calcium deficiency, you may begin to exhibit some troubling symptoms. Symptoms can be varied and intermittent, so it can be hard to detect calcium deficiency until symptoms become more severe. It's better to depend on a bone density test, but some red flags that your body may be calcium deficient are lightheadedness or fainting, chest pains, wheezing, difficulty in swallowing, brittle nails, coarse hair texture, dry and itchy skin, skin irritation or psoriasis, muscle weakness, numbness or tingling in hands and feet, irritability, anxiety, or depression. To remain strong, your bones also require regular intake of vitamin D. Unlike calcium, your body can produce its own vitamin D. It is made in your skin when sunlight shines on it. Vitamin D also participates in a variety of body systems and functions. It regulates mood, it wards off depression, helps maintain healthy body weight, reduces risk of heart disease, promotes strong immune system function. Now, as it relates to bone health, vitamin D regulates the absorption of calcium and phosphorus. If your body isn't able to absorb enough calcium, bone integrity is weakened, fractures and breaks can occur more easily. Vitamin D deficiency also interferes with comorbidities of COPD, such as heart disease, muscle weakness, and increased inflammatory immune response. The relationship between healthy magnesium levels and effective calcium use is a complex one. Magnesium is essential for the body's proper absorption and use of many important nutrients, including calcium. While healthy calcium levels are essential for bone health, if calcium is allowed to build up and is not absorbed properly, or basically not properly absorbed, it becomes toxic and can actually weaken bones and also cause digestive issues. Calcium is essential in tensing and stimulating muscles and nerves, while magnesium calms and relaxes them. Maintaining balanced magnesium and calcium levels can help with bone density health. There are supplements available for bone health, which your doctor may prescribe, but there are several healthy foods that can provide the nutrients as well. 3 servings of dairy per day will be more than enough to keep your bones strong and healthy. Some respiratory patients find that dairy products thicken mucus or increase its production. If you have this issue, don't worry. There are several delicious not dairy options. There are several juices that are available that have been fortified with calcium. Veggies like broccoli and kale are rich in calcium. You can even get creative, indulge in a healthy smoothie or calcium fortified ice cream. To get some vitamin D, you can soak up some sun. There are many cereals that are fortified with vitamin D. Salmon, tuna, and eggs are also some other foods that are rich in vitamin D. You've already learned that exacerbation avoidance is key to slowing disease progression. Magnesium is not only essential for bone health, it is necessary to keep your immune system in tip-top shape as well. Magnesium is lost when foods are processed, so stay away from canned or processed foods. To get more magnesium in your diet, you can load up on fresh fruits, beans, seeds, nuts, and leafy green vegetables. We've included a comprehensive list of where to get these nutrients in the nutrition handbook you've already downloaded. Cross-reference this with your suspected trigger list and be sure you are keeping bone health in mind.